Hi, I'm Gautam Kulkarni. I'm a children's doctor in London, and welcome to my YouTube channel. This is going to be a super fun health education channel for parents, children, and even doctors.
Today we are going to discuss celiac disease in children, and how it differs from gluten sensitivity, or even an allergy to wheat. Based on 3 real patients, we are going to cover the symptoms, diagnosis and management. This discussion is specific to children under 18. Roy is a 4-year-old boy with constant tummy aches. He is constipated for the last 2 years despite regular medications. He has a poor diet and drinks a lot of milk. His growth chart shows very slow height and weight gain over the last year. Polly is 16 and extremely sporty. She runs for a club 5 days a week. But she has been very tired recently and is struggling to wake up in time for school. Her parents are getting very worried about how pale she looks and request tests. Her hemoglobin is 88 and ferritin levels are only 4. Millie is 15 and has not been quite right recently. She is having anger outbursts and has started experiencing tics and tremors lately. She hasn't been eating very well and has seen a psychiatrist who has diagnosed her with anxiety and OCD. All of our 3 patients were strongly positive to the screening test for diagnosis of celiac disease, which is the TTG antibody test. So what does this mean? Wheat, barley and rye contain a protein called gluten. People with celiac disease have an immune response against gluten which causes their symptoms. Are oats safe? This is debatable. Oats have a slightly different protein, though some people may indeed react. Celiac disease can present with many different symptoms which may delay the diagnosis. Just as in the case of our first patient Roy, a common presentation in young children includes tummy aches as well as constipation and diarrhea. Older children like Polly might present with severe nutritional deficiencies such as anemia. Though rare, but very important are the immune-mediated effects such as the skin, neurological or even psychological presentations. Many older teenagers such as Millie may present with a combination of symptoms. Early suspicion is very important in the diagnosis of celiac disease. Children can be screened from the age of 2 or 3, unless symptoms are seen before. In children younger than 3, antibody testing may not always be accurate. The most sensitive test remains the tissue transglutaminase IgA antibody test. It is important to see an experienced doctor in the management of celiac disease, as in many children with typical symptoms and positive blood tests, an endoscopy may not be necessary. HLA testing is reserved in special circumstances, where patients are already on a gluten-free diet or where blood tests may show inconclusive results. It is very important to continue with gluten in your child's diet until your doctor has confirmed the diagnosis of celiac disease and has asked you to start a gluten-free diet. A lifelong gluten-free diet is the mainstay of management. It's very important to see an experienced dietitian to understand and correct any nutritional deficiencies. Your doctor will arrange tests to look for other problems associated with celiac disease. As discussed before, most doctors would suggest avoiding oats, certainly within the first 6 months. Though oats don't contain gluten, they have a similar protein, which may cause symptoms in a few patients. In the first few weeks after diagnosis, some children benefit from reducing their dairy intake. Damage to the gut lining means less lactase enzyme production, though this improves after a gluten-free diet. Iron, folic acid, vitamins B6, B12, vitamin D, copper, and zinc deficiencies may need treatment. As autoimmune problems such as type 1 diabetes as well as autoimmune thyroid problems are quite common, children need annual blood tests. Celiac disease is more common with certain genetic conditions such as Downs as well as Turner syndrome. Osteoporosis is a long-term complication of celiac disease, unless strict gluten-free diet is adhered to. It's as essential to have regular follow-up with your doctor. On the other hand, a wheat allergy itself can potentially cause anaphylaxis. To understand this better, please watch the video on severe allergies. It can cause exercise-induced anaphylaxis, where the reactions get worse due to potential cofactors. Finally, there could be a cross-reaction to wheat, when the primary sensitizing allergen is pollen. These reactions are much milder. Gluten sensitivity is a combination of IBS-like symptoms, such as behavior disturbances and systemic symptoms, such as tiredness, muscle pains, brain fog, anxiety, skin rashes, vitiligo. Symptoms occur soon after gluten ingestion, improving or disappearing within hours or a few days after gluten withdrawal. Dietary control for gluten sensitivity doesn't have to be as strict as for celiac disease. Thank you for watching and please do subscribe.